Hello and welcome to Biochem Plus. Today, we are discussing the major symptoms of hypertension, how it is diagnosed, the available treatment options, and practical steps you can take to remain hypertension free. Let's begin. Symptoms of hypertension. Hypertension is often called a silent condition because many people feel completely normal even when their blood pressure is dangerously high. However, when symptoms do appear, they may include the following. 1. Persistent headaches, especially in the morning. 2. Dizziness or lightheadedness. 3. Blurred or altered vision. 4. Shortness of breath during simple activities. 5. Chest pain or a feeling of pressure in the chest. 6. Heart palpitations or an irregular heartbeat. 7. Fatigue or general weakness. 8. Nosebleeds, which occur in some individuals with very high blood pressure. It is important to note that these symptoms are not specific to hypertension alone. That is why routine blood pressure checks are essential. Diagnosis of hypertension. Hypertension is diagnosed using repeated blood pressure measurements. A single high reading is not enough for diagnosis. Instead, pressure is measured on different days to confirm persistence. Doctors may also perform a physical examination, blood tests to assess kidney function, glucose levels, and cholesterol, urine analysis for protein or electrolyte imbalance, an electrocardiogram to evaluate heart rhythm. In some cases, an echocardiogram to check for thickening of the heart muscle. Ambulatory blood pressure, monitoring where blood pressure is recorded over 24 hours, provides the most accurate assessment. Treatment and remedies for hypertension. The goal of treatment is to lower blood pressure, protect vital organs, and reduce long-term risk. Let's look at lifestyle remedies first. 1. Reduce salt intake. Aim for less than 5 grams of salt per day. 2. Maintain a healthy body weight. Even a small reduction in weight lowers blood pressure significantly. 3. Engage in regular physical activity, such as brisk walking for at least 30 minutes most days of the week. 4. Limit alcohol consumption. 5. Stop smoking completely. 6. Increase fruits, vegetables, whole grains, and potassium-rich foods in your diet. 7. Manage stress through relaxation techniques, adequate sleep, and mindfulness. Now, let's move to medications. Doctors may prescribe one or a combination of the following: diuretics to help remove excess salt and water, ACE inhibitors or IRBs to block the renin-angiotensin system, calcium channel blockers to relax blood vessels, beta blockers to reduce heart rate and workload, aldosterone antagonists when needed. Medications are tailored to each patient based on age, comorbidities, and treatment response. Effective treatment requires consistent follow-up and strict adherence. How you can stay hypertension-free. While some people have genetic risks, many cases of hypertension are preventable. Here are practical steps to reduce your risk. 1. Check your blood pressure regularly, even if you feel healthy. 2. Maintain a balanced diet with minimal processed foods. 3. Stay active and avoid long periods of sitting. 4. Maintain a healthy weight throughout adulthood. 5. Avoid excessive caffeine and reduce added sugars. 6. Manage stress early and consistently. 7. Get adequate, quality sleep every night. 8. Follow medical advice promptly if your blood pressure begins to rise. Small, consistent changes have the greatest long-term impact. Conclusion. Hypertension is common, but it is manageable and often preventable. By understanding the symptoms, getting proper diagnosis, following effective treatment, and maintaining healthy habits, you can significantly reduce your risk and stay hypertension-free. Thank you for watching. If you have any questions, leave them in the comments. Remember to like, share, and subscribe to Biochem Plus.